This is a screencast on the genetic disorder Huntington's disease. Huntington's disease is a neurodegenerative disorder, which means that it impairs the growth and development of the brain and central nervous system. It affects about 1 in 10,000 Americans, and it most notably manifests itself in the mid to adult life. Huntington's disease is also the most common cause of chorea, which is an abnormal movement disorder. And additionally, the average lifespan of a human after being diagnosed with Huntington's disease ranges from about 10 to 20 years. There's only one known cause to Huntington's disease, and that's an autosomal dominant mutation on the short arm of chromosome 4. The gene impacted by this mutation is the HTT gene, which is responsible for the production of the Huntington protein. The exact function of this protein is unknown, although it is suspected to share a correlation with nerve cell function. The mutation on the HTT gene that's responsible for Huntington's disease involves a sequence of DNA referred to as the CAG trinucleotide triplet. This triplet is composed of the 3 bases C, cytosine, adenine, and guanine. In a normal human being, the triplet is normally repeated between 10 and 35 times in the HTT gene. However, people affected by Huntington's disease have a repetition of this gene varying between 36 and 120 times. However, people with 36 to 40 repetitions may not even develop the symptoms of Huntington's disease. Here are some graphics displaying the effects of Huntington's disease on a person. Here we can see that a person with 10 to 35 repeats of the sequence CAG is a normally functioning person. A person with 36 to 39 repeats of the CAG trinucleotide sequence may develop Huntington's disease, but may also not even manifest any symptoms of the disease. However, someone with 40 or more repeats will definitely obtain Huntington's disease and all of its implied symptoms. Additionally, below is a graph representing the onset of Huntington's disease in correlation with age and CAG repeats. We see that the majority of onsets occur in the mid-adult life between 40 and 60 years old, while the CAG repeats vary between 40 and 100, with the greater concentration being between 40 and 50 repeats. So here's an image of the Huntington protein that's created by the HTT gene. Like I said, normally Huntington's disease patients have an excessive repetition of the HTT gene trinucleotide sequence with about 36 to 120 repeats. And the effect of this is as this gene goes through translation, it creates an abnormally long version of the Huntington protein. This elongated protein then becomes cut up into smaller toxic fragments that bind together and accumulate in neurons. This disrupts the normal functioning of these cells. The dysfunction and eventual death of neurons in certain areas of the brain underlie the signs and symptoms of Huntington's disease. An important concept that's associated with Huntington's disease and the abnormally long protein production is that as this mutation gets passed throughout generations, the size of the mutation will often increase and the severity of the disease will increase. This is a concept known as genetic anticipation. So here's an image that we see of the Huntington protein represented by these blue shapes here accumulating in the neurons, which are these yellow cells. And the accumulation of these proteins disrupts the normal neuron cell function. So Huntington's disease is associated with 3 different types of symptoms. The first category is known as behavioral changes and psychological symptoms. These behavioral changes can include hallucination, irritability, restlessness, psychosis, which is the inability to differentiate between what is imaginary and what is reality, and paranoia. The second division of symptoms associated with Huntington's disease is referred to as the cognitive symptoms. These cognitive symptoms are caused by Huntington's disease because characteristic of Huntington's disease is a neuropathologic feature that includes a selective degeneration of neurons in the caudate and pitumen of the brain. So here we can see the caudate nucleus and as well as the pitumen. And so what this means is that the proteins that accumulate in the neurons that I talked about selectively accumulate in the caudate nucleus and pitumen. Why this is currently unknown. However, we do know that the caudate nucleus located in the basal ganglia of the human brain is crucial to the brain's memory and learning systems, while the pitumen, which is the round structure located at the base of the forebrain, primarily functions to regulate movement and influence various types of learning. So it makes a lot of sense that the disease symptoms associated with Huntington's disease include impairment of learning, memory as well as movement. So back to the cognitive symptoms, they can include forgetfulness, slowing of process of thought, impaired ability to manipulate acquired knowledge, which is essentially being presented information and then manipulating it and understanding it in a personal way, and obsessive compulsiveness. While it's not very common, Huntington's disease patients have been known to experience schizophrenia, as well as high degrees of hostility. Note, these psychiatric impairments do not progress with the disease. The final division of the symptoms associated with Huntington's disease include the abnormal movements. These can entail facial grimaces, sudden head turning to compensate for where your eyes are looking, and dramatic jerking of extremities such as your arms and legs. However, it is worth noting that in children who have experienced onset Huntington's disease, rather than these dramatic jerking movements, children experience rigidity, slow movements, and tremors. So testing and diagnosis of Huntington's disease is currently somewhat limited because of how little researchers know about the disease. However, testing depends largely upon a positive family history of Huntington's disease, as well as characteristic clinical findings and a positive detection for the elongated triplet CAG. This makes diagnosis largely based off the patient's response to questions regarding family history during a doctor's visit. The doctor will often carry out simple tests pertaining to the patient's reflexes, muscle strength, muscle tone, sense of touch, vision, and eye movement, as well as hearing coordination, mental balance, mental status, and mood. These are all things that correlate with the symptoms associated with Huntington's disease. However, the mainstay of testing for Huntington's disease is genetic testing for the elongated HTT mutation, which involves taking a blood sample from the patient and through genetic analysis, determining whether or not the elongated gene exists. Another commonly used method for testing for Huntington's disease is through brain imaging tests, which may reveal structural changes in regions of the brain affected by Huntington's disease. I talked about how the Huntington's disease protein accumulates in the neurons of the brain and selectively degenerates the caudate nucleus and putamen. So while these changes in the brain's appearance usually don't manifest themselves early on in Huntington's disease, making it relatively ineffective as a method of diagnosis. So the images we see here are images that represent brain image testing for Huntington's disease. This first image represents two brains. The one on the left is a person who is perfectly healthy, no Huntington's disease, and the one on the right is a patient with Huntington's disease. And we can see that these white areas here, they represent a loss of brain mass or just damaging in the brain caused by the Huntington protein. We see how it's significantly larger in a person with Huntington's disease, which just is indicative in a test that a patient with excessive brain damaging has Huntington's disease. Finally, though it's less common, if a patient has experienced any seizures, a doctor may perform an electroencephalogram, or EEG, which utilizes a series of these electrodes which are connected to the patient's scalp. These record the electrical activity of the brain, and certain electrical patterns are stereotypical of Huntington's disease. So currently there is no cure for Huntington's disease. There are, however, ways to manage the various symptoms and implications that the disease entails and ease the life of a Huntington's disease patient. Unfortunately, there's currently no way to also prevent the disease from getting progressively worse, which is something characteristic of Huntington's disease. There are only measures that can be taken to make the patient more comfortable. So a common treatment for Huntington's disease involves the use of dopamine blockers. And while the correlation between dopamine blockers and Huntington's disease isn't very well understood, it's known that these dopamine blockers chemically inhibit spastic movements and help the patient at least retain some mechanical movement. Additionally, amantadine and tetrabenazine, as well as some other drugs, can also be used to gain extra movement. Again, the correlation between these drugs and helping with motion is poorly understood. However, these drugs are known to cause the release of a chemical called norepinephrine from nerve endings. And the release of this chemical is known to give a patient more muscle control. And additionally, there's some unproven treatment using the coenzyme Q10. So this is currently being experimented with and is believed to reduce the oxidative damage in brain cells for HD patients. This slows the development of Huntington's disease over the long term. The way this works is that it's believed that the reason why Huntington's disease manifests itself most commonly in the mid-adult life is because in youth, people have essentially DNA mechanisms that can splice out the excessive repeats of the CAG trinucleotide sequence. However, with age and excessive oxidative damage, people lose this mechanism, and so the coenzyme Q10 is believed to help people retain this mechanism that allows them to splice out the excessive repeats and slow the development of the disease. So something that's actually pretty unique about Huntington's disease is that the disease is not lethal in itself. Rather, the complications associated with the disease are. The first of these complications is pneumonia, which likely results from the compromised immune system that Huntington's disease patients have. And the reason why their immune system is compromised is because the disease entails an enormous amount of stress, and this is an immunosuppressant. And so pneumonia and heart disease are the two leading killers of people with Huntington's disease, and again, it's associated with the stress. There have also been documented cases of choking and respiratory problems that have caused the death of Huntington's disease patients. This results from the inability to coordinate muscle movements that are involved in these processes. And again, it's because of the neurodegeneration of brain regions that control movement associated with the disease. Lastly, for reasons currently unknown, Huntington's disease patients are extremely prone to gastrointestinal diseases and pancreatic cancer. That concludes this screencast on Huntington's disease.